Problems with sensory integration are very common for children from a hard place. Remember from the TBRI discussion that according to Dr. Karen Purvis and Dr. David Cross, co-directors of the Institute for Child Development at Texas Christian University, a child from a hard place has experienced at least one of the following: stressful pregnancy, difficult childbirth, early hospitalization, abuse, neglect, or trauma. About 20% of the general population have challenges with sensory processing, but ICD's estimate is that 80 to 90% of children from a less than optimal environment have sensory processing problems. It is wise for adoptive parents to be educated about sensory processing and anticipate that their child will have some sensory needs. A child who has spent any time during their first years of life in an orphanage is at very high risk for sensory integration issues. However, sensory problems are not limited to the orphanage cared for child. A child having endured abuse or neglect, being placed in a foster home, needing a medical procedure or early hospitalization such as for prematurity, or even having experienced his mother's elevated stress hormones during pregnancy can benefit profoundly from attention or therapy in sensory integration. Sensory input processing means how the body takes in and interprets information. Our sensory systems include the external senses of sight, taste, hearing, touch, and smell, as well as the internal or body-centered senses, the vestibular, proprioceptive, and tactile systems. The vestibular sense is about movement of fluid in our inner ear and is responsible for balance and spatial orientation. In a healthy and nurturing environment, the baby's vestibular system is fine-tuned through interactions with a loving parent. When the baby cries, the mommy holds, bounces, and rocks the baby. As the baby is calmed, there is movement in the vestibular fluid. Every time the baby is loved and held and cradled and rocked, they are having a vestibular movement experience. It is these kinds of experiences that provide the sensory bath, which helps the nervous system organize so the baby can process all sorts of information in a normal, healthy, optimal way. You can engage the vestibular sense by swinging, spinning, or hanging upside down. But this should be limited as a little vestibular stimulation will go a long way. And if too much, your child is likely to melt down. Some very sensitive kids, when their vestibular system is overstimulated, can be off balance for a day or more. We do recommend that you engage your child in a sensory activity every 2 hours, but in general, scheduled vestibular activities should be limited to about every 6 hours. The proprioceptive sense can be considered as pressure and awareness, or how deep touch registers in our muscles. Babies' proprioceptive systems are also engaged through calming. Every attentive parent knows exactly how to pat, bounce, and shush their baby in order for them to settle down. Examples of ways to engage this sense are by lifting weights, pushing or pulling heavy things, using a weighted blanket, playing on monkey bars, etc. The deep chomping and chewing of a few pieces of bubble gum is surprisingly calming. For those of you with children that have a difficult time concentrating on homework, try letting them chew on 3 pieces of bubble gum during the homework session. While they chomp, focus is enabled, and some parents feel like bubble gum is a magic weapon for homework success. The tactile sense is the sense of touch. Touch is our first sense to develop in utero, and it's working pretty well when the baby is born. For example, when you touch a new baby gently on the cheek, he turns his head toward the touch. They love cuddling and being stroked. They learn so much through their tactile systems. Some children with sensory needs may overreact to touch, such as a clothing tag bothering a child's neck, or underreact to touch in that the child doesn't seem to notice when he is touching something or was touched. Tactile underresponse can look like a clumsy child. Tools for the tactile sense are modeling clay or Play-Doh, foam, goo, finger paints, sand, lotion, dry rice, etc. Sensory processing disorder, or SPD for short, can happen when the vestibular, proprioceptive, and tactile senses do not appropriately develop and one has difficulty in managing the sensations that come in through the environments. In situations where nurturing care is not consistently available to the child, or when a child is left in an orphanage crib unable to explore their world, they do not have the same type of sensory bath through holding, talking, cuddling, rocking, calming, soothing, cooing, etc. Confused sensory interactions occur, which means the senses do not work together as they were intended to understand the information that is being taken in. To a child with sensory processing disorder, his or her world feels scary and out of control. It has been described as living life in the spin cycle of a washing machine. Everything is either too loud and too fast, or the child craves constant movement and touch. For children with untreated sensory problems, there is rarely a happy medium. This does not mean that the untreated child acts out all the time. In fact, they may work very hard to keep themselves under control when they have to, such as at school. But it does mean regular interactions and experiences in life are harder for this child. They are likely to melt down at home after school. These children are sometimes described as being very hard sleepers. They are often so exhausted and overwhelmed that they just pass out at the end of the day. Children with sensory processing disorder are also prone to delays in physical development and language skills. They may become upset with loud or unexpected noises or agitated by strong perfumes or odors. Certain food tastes or textures are likely to be refused. Very vibrant colors and movements may be overwhelming. The child with sensory problems may refuse to wear or insist on wearing certain clothing. They may be unusually active or inactive or both. Outbursts and withdrawal are both common. These children may be afraid to try new things, often saying, "I can't." They may be considered distractible or whiny and could seem clumsy. Team sports are usually very hard for sensory children. They may become dizzy easily, such as when the head is raised or lowered. The sensory challenged child also has a hard time following directions, especially in the classroom setting. They may avoid or seek getting their hands or feet dirty. When working with objects, they are likely to only use their fingertips rather than their whole hands. These children have difficulty coordinating both sides of their bodies and seem to go limp when held. They are prone to behavioral meltdowns. Clearly, children with sensory processing problems do not have the internal peace and physical or emotional balance that we want for our children to have. For these children, and for all children really, a daily schedule that includes many sensory-rich activities is recommended. Every 2 hours, if possible. Choose an activity off the physical list, then tactile, then physical, then calming, then physical, then 2 and 1. The physical activity should take between 5 and 10 minutes. Examples of these activities include running around the house 5 times, jumping rope, bouncing on a trampoline, sit and spin, cartwheel practice, crab walk, swinging, obstacle course, and swimming. Examples of tactile activities include Play-Doh, finger paint, shaving cream, digging in a rice bucket, foam, playing with a sewing card, feel and guess games, and using a sand and water table. Calming sensory activities include playing with a stress ball, doing a wall push-up, utilizing a weighted blanket, chewing bubblegum, doing a chair push-up, stretching, and yoga. 2-for-1 activities are those that meet both a sensory activity as well as another need. Crispy and crunchy snacks will engage both the child's sensory need and nutrition need. Red light, green light game engages a sensory need and also a need for self-regulation. Blow and pop bubbles meets a couple of needs as well. Massage, especially between a parent and child, is very healing and facilitates attachment. Taking turns with hair brushing allows the child to brush mom's hair and then mom brushes the child. Not only does the child have the experience and feeling of having their hair brushed, but they are also able to give care to their mother. Human sandwich is also an attachment building and sensory activity. And mirror play is a particularly good one. If you do, say, 6 or 7 intentional sensory activities in a day, 3 or 4 should be from the physical list and 1 to 3 of the other categories. Sensory activities don't need to be too formal. There are many things that a healthy and active parent would do anyway with their child. Instead, it's about being aware of your child's need for sensory experiences and intentional about making sure they occur. Occupational therapy, by definition, is the use of treatment to develop, recover, or maintain the daily living and work skills of people with a physical, mental, or developmental condition. Occupational therapy interventions focus on adapting the environment, modifying the task, teaching the skill, and educating the client or family in order to increase participation in and performance of daily activities, particularly those that are meaningful to the client. An occupational therapist well trained in childhood sensory integration issues can be a highly valued member of your child's team to succeed by teaching and refining the skills that the child will use to succeed in his or her social, academic, physical, and family environments. I must say, I have never met a family who incorporated occupational therapy into their child's schedule that did not experience remarkable progress. Before we go on to an interview, please first pause the film to discuss and reflect upon the following questions. Are you willing and able to incorporate sensory activities into your child's daily schedule? What sensory activities could you offer to your child? Where do you anticipate you may have problems or challenges with providing a sensory-rich environment for your child? Sarah Melanson completed her undergraduate studies at Transylvania University and graduated with her master's degree from Washington University, one of the top 2 schools of occupational therapy in the nation. She has been in the field for more than 10 years, currently practicing as a registered occupational therapist in Lexington, Kentucky. Melanson's experience ranges from work with infants to teens and adults in home, school, and clinic settings. She has also completed extensive training in sensory integration, reflex integration, and fine motor development.
Adopted children can have a variety of factors that play into sensory integration difficulties. Some of those can include prenatal factors, whether it's prenatal nutrition, substance abuse. Prenatal factors, contributions like low birth weight or trauma at birth that can play an effect, as well as lack of emotional attachment to a caregiver in the first few months, and lack of different sensory experiences early on, whether it just be being held and being touched and cuddled, being able to move freely, and experiencing a variety of different things, sounds, sights, smells, that can all play into some sensory integration difficulties. One other factor is when children who are adopted can have experienced different traumas, which whether it be prenatally or after birth, and that can just put undue stress on the child. And when those stressful events occur, then it's more difficult for their bodies to make sense of all the sensory information that are provided through the environment. Well, children with prenatal substance exposure can experience a variety of things, such as low birth weight, irritability when they're newborns, premature birth. There can be cognitive concerns later on, other kinds of developmental things that go on where they're just behind their peers. But all of that prenatal exposure can, again, put stress on the child. And so then when they are born, it's again, much more difficult for their bodies to make sense of what's going on. The physical. Okay. Yes, they can be hypersensitive. Children with particularly amphetamine type exposures, they're much more hyper, and they can be more irritable. And children with prenatal alcohol exposure are also often more impulsive later on. They're, I mean, everything can play into it, but in general, children with sensory integration difficulties can be oversensitive to stimuli, so they may not be able to handle different textures, touching grass or different sounds, different touches. They can be low sensitive to where they don't really register input. They can almost break their toe and not even cry about it. Or they can be seeking a lot of sensory input where they are crashing into things and jumping off of things, being unsafe, just because they need all of that extra sensory input. So sometimes especially when children are newly adopted and they're kind of thrown into this new environment and they're not used to the different touches and hugs, they're not used to different sights and sounds, they're not used to just all of the things that are in a new home, new faces. It can be very overwhelming for the child. And again, that's when those stress levels really increase. And so a child's going to do what they can for survival. And so that may be to shut down to where they don't want to have eye contact. They don't want to be touched. They don't want to be moved. They don't want to be cuddled. Their body doesn't understand that sensory input, especially if they've been in a place that's been deprived of touch. I don't want to say it's painful to them, but it's very, it doesn't make sense to their bodies. So a newly adopted child, you really have to tread lightly, and, even though you're very excited and maybe want to show them off to your family or go on, outings, that may not be the best thing for the child. You want to set up an environment where they feel safe. So if that means that you're not holding them in your lap, you're sitting next to them, that can be much more safe to the child. If that means you then can put one hand on them and gradually get to the point where they can accept the touch. Shut down, you can really see it in their face. They cower away. Their pupils can often be very dilated because they're just overwhelmed. Just really reading their cues to see what they can do. And it's also good before getting the child, you can meet with a therapist to see, okay, these are some things I'm afraid of. Maybe what could we do? How can we set the environment up to set the best safe experience for the child? And it could be sometimes the child doesn't. Maybe they're just off the charts. They're going and crashing into everything. And again, that's another way where they're trying to make sense of what's going on. So seeing a therapist before even adopting the child is good. And then in that new period, it can be even good to consult with a therapist. And the therapist can provide ideas and help you problem solve what, you know, my child's doing this. What do you recommend? Or my child's doing that. And then later on, as the child gets more accustomed to their environment, having the therapist work directly with the child can be a good way to help. And sometimes things aren't as severe as, a total shutdown or as vomiting or lack of sleep. Sometimes they can have much more subtle things going on where, genes are bothering them, or the cafeteria is too loud, where you don't think that it's really impacting them, but it is. And we want the child to feel the most safe and the most secure in their own body so that they can really succeed and attach to the family. Well, one thing is when you have the child that's newly adopted, you want to make sure that you don't over bombard them with sensory input. You can provide different things, movement experiences and different sights and sounds and smells and things, but you don't want to overstimulate the child, because then you're just going to get shut down and they're not going to be able to make sense of what's going on. So you'll have to really read the child's cues in order to see if they like a certain type of thing or they don't like a certain type of thing. Once you get to know the child, you can offer experiences such as climbing, swinging, crawling through tunnels, playing with different fabrics and dress up, parachutes, different tactile experiences, so like with Play-Doh and bins of rice and beans, all different types of things. It's going to be all new to them anyway, different types of clothes and all different sounds and things, but just really reading the child's cues and being able to see what they like. And then, if they are apprehensive about something, say they don't like certain touches, you can get them engaged in the things they do like, say it's climbing and swinging, and then gradually provide exposure to different touches. You never want to force the child into something, but if they can, just touch the container that the rice is in, and then maybe, dig a toy out of the rice, and then maybe put their whole hand in it, and gradually let them get comfortable with it. But those are all different things for a sensory-rich environment that are good. The Wilbarger protocol is a deep pressure sensory input that's provided with the brush. It needs to be provided in the right technique to where it's a deep pressure and not just a light touch. The deep massage type technique of it is what provides the most benefit. And then after you do the brushing, it's a surgical scrub brush, and after you do that deep pressure brushing on the arms and legs and back, then you follow that up with joint compressions. That's what we call a proprioceptive input, and that's an input to the muscles and joints. And then you can follow that with movement, and providing that sensory input on a regular basis. The protocol specifies 1.5 to 2 hours of waking time in between brushing sessions. Providing that frequent and sensory input helps the body to make sense of things. There's research out there that shows that decreased cortisol levels, which again is that stress hormone, following the brushing protocol. So, but again, it's important to have the right technique, so a trained therapist can show you that, and it's also important to do it on at the right frequency. If you just do it a couple times a day, you're not going to get the sensory input and the benefit from it. Some children will seek it out. They'll go and grab the brush and request that they get it done. And all children can benefit from it. It was designed for children who are sensitive to touch, But I find that other children that are seeking, the sensory seeking ones, even the ones that are under responsive, they typically like it too because it just helps them improve their body awareness. Blankets are, they again provide that deep pressure throughout the whole body. You want an even distribution of the weight. And you want it to be no more than 10% of the child's body weight, typically. If it's a blanket like on a bed, you don't want the edges to go over the mattress because that can make it more uneven. However, there are a variety of weighted products, whether it's a small blanket or whether it's a pillow, a vest, different things. But all of those weighted products just provide that deep pressure and improve the child's body awareness. And it's just, in general, it's calming. Some therapists will say don't use it too much because then the child will accommodate to the sensory input. But I typically go with the child and read the child's cues. If they like it, then they're going to seek it out a lot. It can be used, before bedtime or while they're going to sleep or while they're sitting trying to, eat a meal, anything like that. It just kind of calms the body down. You also want to pay attention to the fabric of the blanket. It's got to be a fabric that the child likes. Otherwise, they're going to be so concerned about the touch of the fabric that they can't accept the sensory input from the weight. So sometimes we'll have a child go and pick out the material, and then they're fairly easy to make if you have any sewing skills or know someone that does. But they have provided a lot of children with good input. So. I would recommend probably the best way to get a good therapist is through word of mouth. There are probably plenty of other families that have adopted children that have gone through the same things, and they can be the best resource. There's not really a national directory for therapists, but most therapists do have training in sensory integration therapies. You could always find a place that works with all types of children with different developmental needs, and they would have an OT on staff in which you could probably interview the person and see, what their experience is, or usually whoever they're working with can kind of direct you to who would be the best person for them. First Steps in Kentucky is a good resource. A child birth to 3 can get therapy services if they qualify, and most of those therapists are, really used to working with children that are young and can help. Also, your local school system, they have occupational therapists, and even though that those therapists are working in the school, they may know other therapists that can work with children outside of the school privately. So that would be, I would say, some good ways to go about it. And again, just kind of word of mouth and seeing who your child responds to.
Our son was placed with us through the foster care system at 9 months old. We don't know everything about his past, but we do know he was exposed to drugs during the pregnancy. At first, the only obvious sign of drug exposure was his inability to latch to a bottle. As he began to grow, we started noticing he was a little late on meeting developmental milestones. He didn't walk until he was 16 months old. In addition, he was overly active and required constant supervision. He was extremely impulsive and was never able to sit still. His preschool teacher said, "He only plays with things that aren't toys. He's constantly seeking out door stoppers, electronics, and cleaning supplies." We completed early intervention assessments, but he never qualified for services. It was discouraging and exhausting, but we knew he needed to get help to secure the best possible future for our son. Finally, we received a referral for an experienced occupational therapist who educated us on sensory processing disorder. The OT informed us that our son was a sensory seeker and needed more input than the average child. She said it was like he was floating in space but was expected to function like everyone else. OT has been life-changing for our son and our family. His potential in school is maximized, and his teachers now understand his sensory issues. Most importantly, we learned it wasn't solely about changing our son's behaviors, but altering our lifestyle and parenting to help him thrive in a sensory-enriched environment.
We couldn't really do much to comfort her, so we began speech therapy, including sign language. This gave Lillian the feeling of having some control over her environment and decreased her stress levels, alleviating her night terrors. We also enlisted the help of an occupational therapist for a while. She taught us how to look for and avoid stressful sensory triggers in Lily's environment. Too much noise, activity, strangers, crowds. She also gave us some therapeutic exercises to aid Lillian in dealing with her sensory issues. These activities also decreased her stress levels, anxiety, and alleviated her night terrors. The single most important thing I did was carry her close to my body in the hip hammock baby carrier. Up until recently, as she is now too big, she could retrieve the carrier and bring it to me if she was feeling anxious or upset.
They favor their native food and could have eaten rice and beans each day of the week. Since they were not used to refrigeration or canned foods, they still don't like anything cool or mushy, like canned pears, peaches, or applesauce or yogurt. They added lots of spices to bland foods. They were used to living outside with 50 other kids, so their voices were very loud. Getting used to our speed of walking, eating, and working was hard. They were used to a culture that had no sense of time and no hurry to get anywhere. So jumping on the trampoline, swimming, and other physical play helped them to be calmer during indoor times. If your kids have real issues with touch, taste, or loud noises, your school's occupational therapist may be able to help.
Regular exercise was and still is important for our children. This works well because we are quite an active family. It seems when the boys don't run and play a lot, their behaviors are extremely difficult. They play wrestle often, and I realize now that this is meeting a proprioceptive sensory need. Joining a health club with an indoor pool and gym has been our saving grace during the winter months. Frequent snacks and good schedules are important in our family to keep everyone on track.
Many children from a less than ideal start in life will have a great advantage from incorporating massage therapy and sensory activities into their routines. When these sensory experiences are coupled with intentional attachment activities, the child's physical and emotional growth will maximize. When the parent is aware of and in tune with the child's sensory needs and are making sure that sensory needs are met, it is as if the child is primed and ready for attachment. Massage provides an excellent sensory and attachment building activity. Most people respond really well to massage therapy. If nothing else, maybe meet with a massage therapist and bring a child with you for practice to show you massage motions that can be used when your child comes home. But a quick note on massage: it should only be done with the child's permission. No matter the child's age, even an infant should be asked if they are ready for a massage, and you should respect their answer, whether a verbal response or nonverbal cues that a baby can give.
Summer Wilson graduated from the University of Kentucky with a bachelor's degree in psychology. She's a licensed massage therapist who specializes in pediatric massage, and she is also an infant massage instructor. She and her husband, Stephen, are proud parents to a beautiful son they adopted from Ethiopia. Summer enjoys working with adoptive families through nurturing touch to encourage bonding between parents and their children.
Touch is the only one of your five senses that you can't live without. So by adding massage into your daily routine and as part of your bonding experience with your child, you're allowing them to receive touch in a healthy way that allows their body to produce different hormones that lower their stress levels and raise their feel-good hormones, if you will, and allows them to be able to actually bond emotionally and to develop cognitively and physically. All of those areas can improve when they're receiving healthy touch, and it's changing the hormones in their body to be able to allow them to do that. Well, massage is a face-to-face encounter. So if the child's laying in the floor or sitting in a chair, you're making eye contact. And when they see you enjoying being in their presence or laughing at their faces that they're making or different things like that, they have the opportunity to not only mirror your speech. If you're saying, I'm going to massage your hand or your head, they're learning body parts. But at the same time, they're mirroring your emotion and they're mirroring your facial expressions. And that's why it's a cognitive experience as well. They're able to learn while they're receiving the massage. You never want to be in a position where you feel like you're doing massage to somebody. You're always doing massage with that child. It's a two-way communication, and though your role might not look the same as their role, giving and receiving, it's still twofold. So that's why it's important to ask permission in the beginning, to receive permission, and to continue to check in throughout the massage, because it's not for them, it's for both of you to accomplish that bond. With any infant or any child that's nonverbal, the typical symptoms or the typical signs that you're going to get from a child that does not want or is not ready to receive massage is general disengagement cues, like no eye contact, no smile, not responding when they're hearing your voice. For an infant, it can be the reflex such as finger splaying, which is where they put both hands up and all the fingers are splayed, arching their back. Hiccups is a sign of overstimulation, so if they get hiccups throughout the massage, that means it's probably over. They've done too much. Another one is just fussing. If they get to the stage of crying, that's a good indicator that it's over. Arching their back, I might have already said that, or wanting to roll over, different things. There's lots of different signs that they can give that allow you to know that that's probably over.
Or they just say, Mom, I've had enough.
Yeah, and it doesn't always mean it has to end right there, but they at least need a break, And when you go through a massage session or get some infant massage training, they'll talk to you about some different ways that you can help them self-soothe or calm from an overstimulating experience, and maybe you can pick right back up, or you'll know, just discontinue and pick up at another time during the day. For an older child, they can pretty much communicate what they do and they don't want to do. With massage, because you are trying to create a bond and you do want them to enjoy the massage and enjoy the activity with you, you want to make sure that it's not a bribing situation, that you're not coaxing or begging, that you're doing it on their own terms. And it's easy when you know a child and you understand what they like to incorporate massage techniques into things that they will think is fun. If you have an older child who is into cars and they say that they don't want massage at that particular time, but in playing cars you can run it over their legs or up their back or over their arms and different things like that, they're still receiving the touch. You're using a tool, but they're getting the same benefits, and so are you, and eventually that will lead to massage and different things like that. But for an older child that can communicate verbally, they're going to be able to tell you yes or no once you define what massage is. For a child that you suspect might have a history of abuse, it's important to seek out therapy in a professional therapeutic setting. The reason being, if you're excited or if you had the idea that massage might help your situation as far as being able to introduce touch with a child that has this past, in most cases the child has the past with somebody that they should have been able to trust in a place that should have been safe. So introducing massage into your daily routine in your living room is not the best idea, because it's important for that child first to learn what healthy touch is in a place that is in a professional setting, and even somebody having a name badge and different things like that help them to define what professional and healthy touch is. And so if you go into a session with somebody that's been trained specifically in pediatrics, and in this case with children that have been abused or have experienced negative or unhealthy touch in their past, it makes it much easier for them to receive touch in an environment that feels therapeutic. And for your first session, that might look like the child watching you receive a massage as a parent, a shoulder and neck massage, and understanding and seeing how you give permission to be touched and how the therapist respects those boundaries. And it's important too in this process to be respectful of the time frame that that child takes to be able to allow themselves to receive massage as a therapy for them to heal, and also as a therapy to bond with you. And so as long as your goal is to help the child heal, and you seek this professional help with somebody that has been trained to instruct and to do that, I think that you will be able to make a healthy transition for that child and for you in using massage in your daily routine. But other than that, I would recommend that you start professionally and let somebody train you so that you can transition that to your home. In most cases, anyone that does any type of pediatric massage and specializes in that has the goal of teaching the parent how to do massage. And the reason for that is because any massage is a way of teaching a person how to self-soothe or how to deal with stressful and or even traumatic events in a positive way that benefits not only your body but your mood, and instead of coping in other ways that are unhealthy or destructive to the person. And so with the parent being able to take instruction home, children are able to receive that therapy on a day-to-day basis versus week to week or month to month in a professional therapeutic setting. So by being instructed, they're able to continue in that therapy on a regular basis and gain more ground more quickly, while also knowing what things will be beneficial for that child. It's important, first and foremost, when you're seeking a massage therapist for your family and for children and infants specifically, to find somebody that has that specialized training. In your basic massage education, you're not going to learn the different things that apply to a child's massage that are different than what goes on in an adult massage. There's an attention span that you factor in, different strokes, different directions work for things that are related specifically to children. For instance, digestion issues and sleep patterns and different things like that can be benefited by massage if you've been trained properly in it, but it's not the same type of massage techniques that happen in an adult massage. And so by finding someone that has that specialized training, you will be able to
really maximize the benefit.
Sure, and not only that, but you'll also receive instruction. Most people who are trained by Infant Massage USA or Little Kids Foundation have been taught not only how to do massage, but how to teach massage to parents so that they can take this technique home and let the child experience the benefits on a day-to-day time frame instead of waiting weeks or months in between each therapeutic session. And when the child is able to have a consistent, healthy pattern of massage in their everyday routine, then the benefits of massage and the bonding that goes on between massage are just increased, and you see more benefits quicker when you're able to take those techniques home. And with massage, with the desire to incorporate that into your adoption, into the bonding process, you want that to be something that the child perceives as a positive experience, something that's relaxing and a place where they can trust you. And so if you take this child to somebody who's not used to working with children, maybe they don't have the patience for it, maybe they don't have the proper setup in their office, or the proper even tools to accommodate a child's massage, the fear or the anxiety that the therapist might have in performing that type of massage would be translated into that session, therefore the benefits would be lost. And so by seeking someone that has the desire to be able to do pediatric therapy and educate parents, you're walking into a friendly environment, somebody that's welcoming children. They don't have to be quiet. It's okay if they're having fun during their session, and they've got the toys and they've got the time and the music that's all geared towards that child, which again is just going to communicate that they are important, how they feel is important, what they like is important. And when you build that esteem in who they are through massage therapy, then that's just another benefit that you can add to the emotional relaxation and the bonding and all the stuff that you are trying to achieve. One thing that I do want to make sure that families know and understand is that massage is not a quick fix. It's a therapy that's expected to take a little while. If you get started and you don't see any of the changes that you expect to see overnight, it's not something to be discouraged by. You're not losing ground, you're just building upon a foundation. If you lay a good solid foundation for healthy touch, the other things will follow in due time. But it's just the art of being patient and hopeful and just waiting for what you're going to see and the fruit that the massage will bear. The more you continue to be patient with your child and exhibit that respect and use massage on a daily basis, the benefits will come and you will see your child responding in a positive way. And as long as you can be patient and waiting for that, massage is the right kind of therapy for your family. I'd be happy to show you what a typical massage session would look like. I'm not going to go into detail about the different massage techniques that I'm using, just because that's something that you would want to seek professional training for, so that you can make sure that you're using proper techniques and appropriate strokes for the different body areas. But in this session, Gianna is going to help me. She's 8 years old today, and the first thing that you always want to do is ask permission. Whether it's your child or whether a therapist is working with your child, you always want to make sure that somebody respects their boundaries and their space and can respect no, quite honestly. And so today I'm going to say, Gianna, would you like to receive massage today?
Okay.
Okay, sure. Well, if you don't mind, what I'm going to have you do is come sit a little bit closer where I can reach you. And I've picked out a few different things. Have you ever had a massage before?
I've done one to my mom.
You've done one to your mom? Okay, so you know what massage is. You know that you use your hands, and you can either use them to rub gently or to scratch. Which one do you like better?
Rub.
You like rub better. Okay. Well, before I use my hands, I've got 3 different things. Do you know what these 3 things are? Do any of them look familiar?
Yeah.
Yeah?
Sort of.
Which one? Do you know what this is? This is a dog's toy. Do you have a dog?
We have 2.
You have 2? Okay, well this is a dog's toy, and I'm going to show you how you can just use some different things that you might have around your house that actually feel really good on your back. Do you care if I massage your back with the dog toy? Okay, I'm going to have you turn around, even though it's a little bit silly, and I'm going to see if you like the way this feels. How does that feel? Is that good? Mm-hmm. Toys are a good thing to use, just because, especially for a child that's not ready for skin-to-skin contact, this is a safe barrier for them. And so if you're using a toy, it's less stimulation, and it's also it feels safer for the child. So when they're willing to let you lay down the toy and then use your hands, then you know that you have accomplished or made a stepping stone in what the child's willing to receive. We also have just a typical paintbrush that can also feel like massage. You're still able to apply the pressure. Do you like the way that feels, Gianna? Does that feel good? And it still feels as good as massage. It's still relaxing, but again, it's a toy. It makes massage a little more fun. And this is just a duster or something that you would wash your car with. It just provides different tactile stimulation. And for any child that might have sensory issues or again, not like skin-to-skin contact yet, this is just a fun way to be able to do all the different massage techniques that you would normally do in a session without them having to do skin-to-skin. Also, another fun way is, Gianna, do you have spelling words?
Yeah.
Okay. What can you tell me 2 of your spelling words for this past week? Do you remember them? If you don't, that's okay. How about you guess what I'm spelling on your back, okay? So you could just use your fingertips to make different letters on their back. The first one is...
C.
Uh-huh.
H.
And do it again. You know what letter that is?
I.
Close. Here we go. Let's try again. This is just more massage, so that's a good thing.
T.
This one's actually an A. I must not be drawing it very well. Okay, so we've got C, A, and then here's the last letter. Okay, are you ready?
T.
T. And so that's another way that you can use something they've already got going on as a way to provide dialogue for your massage and be able to communicate what's going on in the child's life and be able to incorporate touch. That's one of the benefits to using massage in your everyday routine with your children is they're not always going to let you rock them and they're not always going to be able to take a bottle, but they'll always let you massage them even through high school. And when you're doing massage and you're touching and you're sharing that bond, you're going to continue to communicate through the years and sit down and have those one-on-one conversations that are beneficial to your relationship, not just in infant and childhood, but all the way into early adult.
And for our segment review, most adopted children will have sensory needs and can benefit from incorporation of sensory activities into the daily schedule. The sensory system includes both external and internal senses. The vestibular sense is mostly about balance and spatial orientation, and the way that deep pressure registers in the body is the primary function of the proprioceptive sense. The tactile sense is about touch. Sensory processing disorder is the body's misunderstanding or misinterpretation of the sensory input it receives. Providing the child with a sensory-rich environment where a sensory activity is engaged about every 2 hours can result in a calmer, happier, more regulated child. Occupational therapy can be profoundly helpful with the child's sensory integration. Therapeutic massage, especially between parent and child, is a powerful sensory and attachment building experience.